So welcome back to your channel, I Love Pharmacology. In this session, let us learn about what are the effect mediated by propranolol on the cardiovascular system as well as the respiratory system. As you know that propranolol is a non-selective beta blocker which blocks beta 1 as well as beta 2 receptors. In the heart, we have got beta 1 receptors predominantly, thereby it blocks the beta 1 receptors on the heart. Whereas in the respiratory system, so it blocks the beta 2 receptors. Beta 2 receptors are predominantly located in the bronchial smooth muscles. So how to remember? So human beings have one heart, so thereby beta 1. So we have two lungs, thereby it is beta 2 in the lungs. So what is the effect? So it blocks the beta 1 cardiac mediated activity as well as beta 2 mediated activity in the lungs. So whenever the beta 1 is stimulated, there is an increase in the heart rate, there is increase in the cardiac contraction, etc. So whenever you block the beta 1 receptors, what happens is, so there is a reduction in the heart rate, there is reduction in the contraction capacity, there is reduction in the conduction velocity. Apart from that, on the respiratory system, since it blocks the beta 2 receptors, beta 2 is responsible for the bronchodilation. So thereby, whenever you block the beta 2 receptors, the lungs will go into spasm. So thereby, there is a bronchoconstriction which produces bronchospasm leading to bronchoconstriction, and it leads to difficulty in breathing. So are there any safe beta blocker in case of the person who is suffering from bronchial asthma? So there is a relatively safer drug in case of bronchial asthma, but it should not be used at all. So because there is an increased risk of precipitation of the bronchoconstriction. So relatively safer drug that can be used in asthma is, it can be remembered as just, so C for celiprolol. Celiprolol, which blocks selectively beta 1 receptors, and it has got additional beta 2 agonistic activity. Beta 2 agonistic activity which dilates the bronchioles by relaxing the bronchial smooth muscles. Thank you.